Hello and welcome. I'm Vincent McCory. This is Africa 54. Tonight, the scourge of Ebola continues to menace West Africa. Police in Sierra Leone are now blockading rural areas hit hardest by the deadly virus. To the east in Liberia, the nation is now under a state of emergency as it tries to corral the worst ever outbreak of the disease, which has killed over 900 people across the region. For more on the Ebola crisis, we turn to Africa 54 health correspondent Linord Moudou.
Hello, Vincent. Liberia President Ellen Johnson Sirleaf declared the state of emergency late Wednesday. The move will allow for 90 days her administration to impose restrictions on civil rights by imposing quarantines on the worst affected areas. Liberian Vice President Joseph Boakai Sr. says the state of emergency was necessary to help authorities cope with the situation.
It has been heightened to an extent that a lot of things were not falling into place. Just what I said, the medical doctors, they were not getting access to the patients because they have been attacked. So, and then we also wanted to restrict some of the movement so as to be able to give chance to take charge, to be able to control the disease. So I think the state of emergency is in place for the moment to be able to give us chance to deal with the situation effectively.
The Ebola outbreak in Liberia is taking a heavy toll on the nation's healthcare industry. President Johnson Sirleaf said in a statement late Wednesday that 32 healthcare workers have died due to the disease and many other sick people are going untreated after doctors left their posts. However, Liberia continues to step up its efforts to fight Ebola. On a typical Sunday in Liberia's capital, Monrovia, a trip to the church is the norm for most citizens in the majority Christian country. However, since the Ebola outbreak, churchgoers are taking part in a new ritual reflected in the belief that a diluted bleach solution can kill the virus.
Inside the bucket, they have chlorine. They mix the chlorine with the water, and then with the sanitizer and with the liquid soap, put everything in the bucket to make it one. So you won't have to wash your hand with only the chlorine, then you come back and squeeze whatever. So everything is mixed in the bucket, so as you wash your hands, everything is okay with your hands.
The disease has killed more than 150 people since March. Now a campaign has spread nationwide to raise awareness. Churches like St. Stephen's and religious organizations have played a key role in spreading public messages about prevention measures. Nurse Gloria Stevens speaks at the St. Stephen's Episcopalian Church.
Hand washing is so important. We need to wash our hands more often. People, even before there's Ebola, people, when they go to buy fruits and stuff, they don't even wash them. We need to be able to do good hand hygiene and even wash our fruits and things as we go along.
Some communities are still in denial about the disease and have attacked outreach workers. But Tarlinto Thomas, a mother of a 4-month-old baby, is taking no chances.
I worry a lot. Normally people always hold my baby, but I put stop to it. Since Ebola came, I avoid shaking hands, I avoid hugging people and avoid eating with people.
WHO says the virus has already killed almost 1,000 people in Guinea, Liberia, Sierra Leone and Nigeria. Ebola causes severe muscular pain, fever, headaches, and in the worst cases, unstoppable bleeding. No vaccine is available. And here in the United States, 2 Americans that contracted Ebola are being treated with an experimental drug that seems to be helping their condition. While speaking at the U.S.-Africa Leaders Summit, President Barack Obama says it is too early to consider sending the experimental medicine to West Africa. Mr. Obama says more needs to be learned about the drug.
I think we've got to let the science guide us. I don't think all the information's in on whether this drug is helpful. What we do know is that the Ebola virus, both currently and in the past, is controllable if you have a strong public health infrastructure in place. And the countries that have been affected are the first to admit that what's happened here is that their public health systems have been overwhelmed.
President Obama says the countries affected by the virus should focus on building a strong public health infrastructure. Meanwhile, the World Health Organization says the use of the drug on 2 Americans raises questions about whether untested medicine should be used in the outbreak, and if it is used, who should receive it. And that's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thanks a lot. Now be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.